So let me talk a little bit about the older person with lung cancer.
Okay.
So what's the most important risk factor for lung cancer? Smoking. What's the next most important? Age. And so we're faced just demographically with large numbers of people with lung cancer.
Is the biology of lung cancer in an older person different than in other age groups?
Probably not. There's very little data to the point, but unfortunately, say in contrast to breast cancer, which can be viewed as a chronic disease for women who have metastatic disease, lung cancer is an all-or-none phenomenon. If you present with advanced disease, a person presents with advanced disease, the natural course is unfortunately fairly rapid.
When you say the older person, how old are you speaking about?
So this was a very interesting study of people ages 70 to 89, older. Some of us are older, some of us are younger. But this is the group they chose to study, to ask a very simple question. Should we go easy with the chemotherapy and just give them a single agent? Or should we go with a combination, as we would for a younger patient? Answer, unequivocally, the combination gave a doubling of the endpoints they were looking at, overall survival, progression-free survival, not a whole lot more toxicity. So it really makes the important point that treatment should not be based on age, but rather the best outcome, evidence-based, in this case a combination.
Yeah, there always seems to be this bias that if you're older, you're not going to be able to tolerate treatment. You know,
It's called ageism.
Right.
Never make an
Exactly.
assumption. It has to be an informed decision.
And let me ask you, is the older cancer patient, even though chemotherapy and associated therapies bear these toxicities, are they eager, are they receptive? Do most really older people say, yes, I want to be treated?
So, I mean, you can't make an assumption. And so I go through a process of, as part of the initial interview, and then at each important discussion, elicit what's your preference. And the phraseology I use is, look, some people in this situation, they want to go all out. They want everything done. And some people say, look, it's been a struggle. I really want a more minimalist approach. Where do you fall in that setting as you sit here today knowing what you know? And that informs a discussion, a shared discussion, given the options.
You are such a model, truly. And I've known you a long time. You have a unique, compassionate, gentle...
Thank you. It's not unique, but we certainly hope, and thank you, but patients really should expect that kind of a shared decision, and to have elicited what preferences are. If it's age or whatever, you can't make an assumption. And I tell you, I always get surprised, but I never make an assumption until I ask that question.